Hi, it's Dr. Amanda with StraightSmile Solutions. Today we're going to be talking about toggling from one treatment plan to another for Invisalign. And keep in mind, this is only applicable to ClinCheck Web. I prefer to use Web. Well, first of all, I'm a Mac person, so I don't really have a choice, and I'm just used to it. But I don't like using ClinCheck Pro because that involves more work for me. And I'm really good at saying what I need in the comments section and just letting the technicians do the work. It's really easy. You just have to know how to ask for what you want. But that's just me. So, anyways, anything that I reference in a ClinCheck is going to be related to ClinCheck Web. Okay, so let me explain the why behind toggling between different treatment plans. So, for example, let's say you have a 35-year-old female patient, 6 millimeters of crowding, class 1. Okay, pretty standard, easy case, probably an Invisalign moderate case. In this kind of situation, you usually have two options. You can either go extraction, you can go expand and procline, and of course, the direction it's initially going to head on the first ClinCheck is the direction that you have in your clinical preferences. And if you want to know more about establishing the best clinical preferences, you should definitely watch my video on that. I have a really good video on that. If you can't find it, you should be able to search. Just go to my website, StraightSmileSolutions.com, click on contact, and I'll be glad to send it to you. But in any case, I digress. 35-year-old female, 6 millimeters of crowding, 3 options as far as I can see. And every patient always has options. And if you're not giving your patient options, you're not doing good ortho. And that's really because part of doing ortho is doing ortho standard of care, like an orthodontist. And an orthodontist will give their patients options, almost always. It's very rare that you don't have options. Now, just because I'm giving options doesn't mean I'm not leaning towards one option or another. And I don't think one's better, because I do think is one's better. And old school orthodontists don't give options. They just do what they think is best, right? But now in this day and age, in the land of options, patients want options. Standard of care is to give your patient all the options, risks, benefits, and alternatives, right? This is what we learn in our SILP notes. This is what we learn in dental school. Always. And ortho always has options. One orthodontist will have one set, one orthodontist will have another set. Okay, so let's go back to our hypothetical 6 millimeters of crowding, 35-year-old patient. So in any case, with the class 1 canines and molars. So in this case, you're probably going to have 3 options. Anyone, for me, that is, let's say, 15. This case at age 15 probably doesn't really have 3 options. I'm going to lean probably more towards expansion and proclination. I don't like to do IPR on teenagers unless it's the only option. It's not the direction I will lean. That doesn't mean I will not offer it, explain the risks, benefits, and alternatives, but it's not the way I lean. In an older patient with some perio, let's say same patient was 60, I'm probably going to lean more towards IPR because I don't like to expand and procline in a perio patient. Why? The teeth fall out, or they can fall out, and that's a risk, right? There's always going to be some patient, when you explain the risk, that is like completely against the sawing of their teeth, and they'd rather take the risk of expansion and proclination. Fine, great, I explain the risks, sign this waiver that your teeth might fall out later and I'm not responsible. Great, no problem. So kind of get what I'm talking about. So again, back to our 35-year-old patient. Couple options: expansion and proclination, IPR, or somewhere in the middle. Okay. So what I always do is recommend coming up with those various treatment plans. And I can do these. I mean, the cool thing about Invisalign is, in general, they flip these things around in a day or less, sometimes just an hour. So I do one and then it comes back. And then I do the next one and it comes back. So you can see here we have 4 versions, right? These were about 3 days apart, but they were a little slower about this time. They're a little faster now. And always towards the end of the quarter, they're usually slower because there's a lot of submissions come in. And then I can toggle up here by clicking past and going to the various versions, 1, 2, 3, and 4. Sit down with the patient, or now I have a link. You can send it to me. I'll send you the information. If you want to email a HIPAA compliant version to the patient, you don't have to do this in person. I think that's a waste of the patient's time unless there's somebody who's asking for it. You do this virtual consult by emailing the patient the HIPAA compliant versions of all these versions. And then you get on the phone and say, hey, let's talk about this. The main thing we want to let them know is we don't want them to choose it based on the number of aligners, because first of all, I don't want you to have different prices anyways. I want you to have one price. And the number of aligners may change. This is completely subjective, right? So it depends on how compliant the patient is, how accurate your IPR is, so many different variables, the density of the bone. So they really shouldn't even be looking at that. and you're going to ask them not to look at it because that might change. We want to explain the process, the risks, benefits, and alternatives of the IPR, of the extraction, of the expansion and proclination, how it might affect their profile, how it might affect their bite. So many options, so many different ways it could affect them. We need to go over it all with them. And then usually they'll ask you what you think. And if they ask and you tell them what you think, and then they'll tell you what they think, and boom, we're going to go with option number 3. Okay, great. Once they do that, I might spiff it up, optimize it a little bit, and go ahead and hit submit. So that's pretty much how I do it. I just wanted to explain it to you so that you understand how to use what I call the toggle button, but it's actually the pass button in Invisalign Web to really give a better, more optimized treatment plan. Now, true honesty, I mean, I know some people will not take a down payment until after they do this process. I'm going to go ahead and take the down payment. So I might tell them that, we'll have a few options. I'll let you look at it before you decide, but we're going to go ahead and get the patient started. We're not going to get into the nitty gritty of everything. Well, there's a few patients that like to see before they buy, and maybe they're not fully committed. And a lot of times when you can show them the ClinCheck, they're much more willing to go ahead and proceed. But, it does take time to take the records and do all that. So some people will take a deposit. It really depends on how you want to do, right? I know Invisalign is not a huge fan if you're wasting their resources and not buying. So, at least occasionally. So if you're doing like 10, 20, 30, 40 workups for every one case that you actually accept, you might get red flag there. So you want to just, be careful with using this resource too much. But all right, anyways, I've been talking too much. Hopefully that was helpful. As always, keep sending those questions to StraightSmileSolutions.com. All right, thanks. And if you have any questions, we're glad to chit chat with you. It's free. You can just go to the contact button. All right, thanks so much.